If you have a herniated disc in your neck, what is it and what potentially can you do about it? I'm Dr. David Geyer, orthopedic surgeon and sports medicine expert. I share sports, exercise, and health information, as well as stories from some of the world's greatest athletes and coaches to help you become a champion in sports, business, and life. A herniated disc, either in your neck or your lower back, is a really challenging problem. In this video, we're going to talk about a cervical herniated disc or a herniated disc in your neck. Now, again, we've talked about this in other videos. The discs are these shock-absorbing structures between the bones in your neck, and they're normally very stable. But what can happen sometimes is the outer layer of the disc, what's called the annulus fibrosus, can rupture, and then the inner material, what's called the nucleus pulposus, which is sort of a gelatinous material, can sort of leak out and put pressure on the nerves and nerve roots that are coming out of the side of your neck. Typically, it'll just be one nerve root in particular. Now, you may have neck pain related to actually rupturing that annulus, the outer lining, but a lot of times it's not neck pain that is what people will complain about. It'll be a pain shooting down the arm, maybe pain in a couple fingers as it radiates down the arm. It may be numbness in part of the arm, but more specifically at one or a couple fingers. It may be tingling in one or a couple fingers, and most worrisome would be weakness, maybe difficulty grasping and squeezing. It may be fine motor control, something like that. But it can be a really tricky problem. Again, more often in the arm, hand, and fingers, more so than in the neck. Just because you have a herniated disc doesn't necessarily mean that you need surgery. A lot of times people can get better with non-surgical treatments. Things like rest and avoiding activities that aggravate that nerve root. It may be anti-inflammatory medications or even a dose pack of steroids where you take a certain number one day, certain number the next day, and basically over a number of days that medication helps decrease the swelling, decrease pressure on that nerve root, and helps the symptoms go away. Sometimes working with a physical therapist on things like traction and stretching and strengthening the muscles around the neck can be helpful. Sometimes even seeing a spine physician or a spine surgeon where they can do injections to decrease the inflammation around that nerve root can get rid of your symptoms, so you don't always need surgery. But in some people that the symptoms just aren't getting better or they're getting worse, or you're having more neurologic deficits, worsening of that numbness, tingling, and most worrisome would be more and more weakness. That can be an indication to do surgery, where they just go in and take out the extruded or the leaked out part of the disc to relieve pressure on the nerve root. If this video is helpful, I'm thrilled. Click the video below for much more helpful injury information. Make sure to subscribe for all kinds of helpful videos to help you become a champion in what you love to do.